Hello, it's Dr. Rhonda Johnson. Today is Monday, October 10th, 2022, and today I'm talking about polio, monkeypox, and other infectious diseases around the world. Well, is polio back? The answer is yes. The polio virus that's circulating right now in the United States, Israel, and the UK was derived from an oral polio vaccine, which is still being given in some parts of the world. Now, can we eradicate polio? The answer is yes. How do we do it? By getting vaccinated. The inactivated polio vaccine, which has been given in the United States since 2000, is very safe. And for most people, 4 shots gives lifelong immunity. If you are unsure of your polio vaccine status, please talk to your doctor. And if you live in the New York City geographic area, there is a public health emergency for polio. Please get your one-time polio booster and follow the guidance of your New York State Health Department. Now, what about monkeypox? The CDC data shows daily cases are declining in several large U.S. cities. Epidemiologists estimate that the monkeypox outbreak could be contained in the United States sometime in the next 6 months, with domestic transmission eliminated if, and these are big ifs, behavior changes in high-risk populations continue and the uptake of monkeypox vaccines in high-risk populations continue. Now, behaviors that have occurred and need to continue include reducing the number of sex partners, reducing one-time sexual encounters, and reducing sex with partners met on dating apps or at sex venues. However, experts say there is a possibility that monkeypox virus establish itself in one or more animal populations in the United States. And as of today, the experts don't know which animal host is preferred. Well, what about other outbreaks? Well, people are traveling further and more frequently these days across the world. Traveling abroad can increase exposure to infectious diseases caused by viruses, bacteria, or parasites. Now, deforestation and climate change are bringing people and animals in contact where they have never been before. And viruses are constantly adapting, and yes, they can jump species and adapt to human hosts. It's easy to spread diseases globally. We're just one plane ride away from exposure. And we've already seen that something that happens in what we think is a remote part of the world can easily become something that is a concern where we live. I have not spoken about Ebola, but everybody knows there's an outbreak in Uganda that the government is keeping their eyes on. Ebola is a highly contagious, horrible viral disease, and the strain that's currently causing outbreaks in Uganda has a 40 to 60% mortality rate. Now, there's also a cholera outbreak in several nations in the world. Cholera is caused by a bacteria, the cholera bacteria. People get sick when they swallow contaminated food or water. The infection is usually mild but can be severe and life-threatening, especially in children. Countries now that have confirmed outbreaks are Haiti, Afghanistan, Bangladesh, Democratic Republic of Congo, Ethiopia, and Nigeria. That's as of the end of August of this year. Now, malaria remains one of the most common parasitic diseases. It's transmitted through the bites of infected mosquitoes, mostly in tropical regions, large areas of Africa and Asia, Central and South America, Dominican Republic, and Haiti, and some parts of the Middle East and Pacific Islands. Folks, it's important to know before you go what diseases are prevalent in foreign countries, what vaccines you need, and remember, most vaccines take about 2 weeks before you're fully protected. The CDC maintains an up-to-date traveler's health website. It will tell you what you need to be watching for, as well as any vaccines that you need and special precautions that you may need to take. That's my message today. As always, be safe and be well.